Go ahead, ma'am.
Hello, good afternoon. This is Dr. Gayatri Satpathy here. I am consultant at Oasis Fertility, Bhubaneswar. Today we are going to discuss on an important topic, which is when to meet a fertility specialist. Because as we know, infertility is becoming a growing problem. When a couple is not able to conceive, it is an emotionally challenging thing for not only the woman but also for her partner. However, you need to understand that you are not alone in this journey. At least 10 to 15% of the couples who are planning pregnancy, they face difficulty in conceiving. In India alone, we have 27.5 million couples who are suffering from infertility issue. And the cause is not only in the man or in the woman, because at least 40 to 50% of the causes are because of the female problems, and 30 to 40% is contributed from the male side also. So, what is infertility? Infertility is when a couple is planning a pregnancy and they have been trying for at least 1 year, but they are unable to get a pregnancy. Then this condition is called as infertility. So now we'll come to the actual question, which is when to see a fertility specialist. Now, who is a fertility specialist? A fertility specialist is a doctor who has a special interest in the field of infertility, or who has a specialization degree after gynecology in the field of infertility. That means they have trained to study, understand the problems of the infertile couple, and also regarding the management of such couples. So let us now go into each problems when we have to go and meet the fertility specialists who are particularly trained in the management of helping couples in planning a pregnancy. So first important is the duration of infertility. So whenever there is an infertile couple and who has been trying for at least 1 year and have not been able to achieve a pregnancy, so it is then that they should go and meet a fertility specialist. However, if your age is more than 35 years, that is, if a woman's age is more than 35 years, so it is better to visit a fertility specialist if you have been trying for 6 months and you have not been able to get pregnant. Now, age is very important here because, as we know, a woman's age advances, her egg reserve especially falls down, which is more after the age of 35 years. So, after 35 years, it is better not to waste a lot of time, and it is better to get evaluated early. So, 6 months of trying after the age of 35, please go and see a fertility specialist. And if you're less than 35 years, try for at least 1 year of unprotected intercourse. And if you're unable to achieve pregnancy, you should go and visit a fertility doctor. The second important is those couples who have sexual dysfunction, because that is also another major reason for not able to conceive. Now, sexual dysfunction is a thing which can be present in both the male as well as a female partner. In the female partner, there can be problems like decreased desire of sex, or she may be dealing with painful sex, which can be associated with conditions like fibroid. There could be pelvic infection, or there could be adenomyosis, endometriosis, or a female may have psychological problems. Sometimes they have issues of vaginismus, where a woman contracts her thigh muscles and vaginal muscles so much so that she does not allow the male partner to have intercourse. Similarly, sexual dysfunction is also seen in the males. They can have erectile dysfunction, where the erection is not hard enough so that they are not able to penetrate. Then there are various forms of ejaculatory problems also, which is seen in men. For example, they can have an ejaculation where there is no ejaculation at all, or there could be premature ejaculation where the ejaculation happens so early that before the penetration itself, the man ejaculates. So again, that is an important reason for not able to conceive. And then there is something called retrograde ejaculation, where after the orgasm, a man ejaculates, but then this ejaculation goes back inside the body, particularly in the bladder, rather than coming out. So these various forms of sexual dysfunction, if dealt properly, if treated, sometimes they need a psychological evaluation as well as a physical examination, and sometimes backing up with a hormonal examination also. And if treated well, and the sexual dysfunction, if it is treated, the couple can easily conceive naturally. Then the third is those women who have problems in the menstrual cycle. Now, the female can have variety of problems. For example, her periods may be irregular. Her periods may be either very short or they may be very long. The normal cycle length is somewhere between 21 to 35 days. So, if your cycle length is less than 21 days or more than 35 days, you may have difficulty in conceiving. So, better to go and see a fertility specialist. Second is if you have heavy menstrual bleeding. where the bleeding is more than the usual, you're using a lot of pads in a day with clots, or if you're bleeding for more than 7 days. And also the opposite, when you have very less menstrual bleeding, where the bleeding is scanty or less than 2 days. So then again, something not normal. So you should go and see a fertility specialist. And third is when you have painful periods also. Generally, such a condition is associated with a problem called endometriosis, which again causes difficulty in conceiving. So the most common reason for the irregular period, which is very commonly seen, is the PCOS. The incidence of PCOS has lately also increased. Nowadays, we are seeing it very commonly. At least 1 in 5 Indian women are suffering from PCOS. The other important reason for irregular periods are stress. Again, stress to conceive is also an important reason for causing irregular periods. Then the unhealthy lifestyle, which is increasing among the Indian women also, the use of birth control pills, and rapid weight changes. Again, it could be an excessive weight gain or excessive weight loss. So all these things can cause irregular periods. Irregular periods has certain problems that, for example, that either you ovulate but you're not ovulating at the right time, so you may not be trying the pregnancy at the right time, or you do not ovulate at all. So a fertility specialist can know the reason for the irregular periods and help you regularize your periods and also help you time your intercourse well so that you can achieve your pregnancy faster. Then the second is those women who have been diagnosed with certain gynecological problems, and they must also be aware that some of the gynecological problems are associated with difficulty in conceiving. For example, I have listed a few, like you may have PCOS, you may have been diagnosed with endometriosis, or may have been diagnosed with endometrial polyps. So let us see one by one. For example, if you have PCOS, so generally these women have a lot of eggs in their ovaries, however, and the ovaries are also larger in size. But then these women do not ovulate, or if they ovulate very infrequently. That is, few months they may be ovulating, they may be ovulating late, or they may not be ovulating at all. So, women who have this condition called PCOS have a variety of different other problems also. For example, they may be obese, they may have acne issue, they may have hair fall issues as well. And few of the women also have infertility issues where they are not able to conceive. So your fertility doctor can help you regularize your periods. We can also quantify like how much severe is your PCOS and what lifestyle modifications is required. And the good news is that majority of the women with PCOS are able to conceive with the help of medical guidance. The second is medical problem is endometriosis, again, which is also very common. 20 to 30% of women who fail to conceive have been diagnosed with endometriosis. And so endometriosis is a chronic condition. It affects not only the uterus but also the fallopian tubes and also ovaries. So because this disease affects so many organs, there is a high chance for having infertility among these women. So if you have been diagnosed with endometriosis, you should get an evaluation by a fertility specialist because we can know what is the state of your fallopian tubes, how badly your uterus is affected, or if there is any affection in the ovaries, or if there any, or is there any decrease in the ovarian reserve. So this helps us to plan a pregnancy early. Third is women who have been diagnosed with endometrial polyp. Now, very commonly, these women face problems like heavy menstrual bleeding. And on ultrasound, they must have been diagnosed with a polyp. Now, endometrial polyps are very benign things, but sometimes because of their location, because they are present within the uterus in the same area where the baby also develops, they may cause a difficulty in conceiving. So, if you get evaluated, your fertility specialist can guide you depending upon the size of the polyp and also based on the location of the polyp, whether a polyp removal is required or not required. Then the second important thing is the ovarian cyst, which is again a very common diagnosis, which is there in most of the ultrasound scans of women. If you see now, ovarian cysts are again of various sizes and they can be of various types. The most common is a simple ovarian cyst, which generally is nothing much to worry about. But if you have something called endometriotic cyst or any other complex cyst, so that and you require an evaluation by a fertility specialist. Some few small sizes and simple cyst, ovarian cysts may be ignored also, but few of the cysts also require medical therapy and sometimes a surgical therapy. Then there are women who have uterine fibroids. Now, what are fibroids? Fibroids are tumor-like growths within the uterus, and they generally present with heavy bleeding and sometimes some enlarged mass within your abdomen, or and also they may present with difficulty in conceiving. Now, your fertility specialist does a proper ultrasound on you if you have been diagnosed with fibroid, and we can tell you how big is your fibroid, where exactly is the fibroid, and what is the distance of the fibroid from the uterine cavity. So based on these things or based on this assessment, a fertility specialist can guide you whether you require the removal of these fibroids, or we can try medical therapy, or if there is anything at all to worry, because there are few fibroids where we do not have to interfere also. Then there are women who have been diagnosed with some uterine anomalies, which are called as congenital uterine anomalies, because these are by birth. So the normal size uterus is how you can see on the screen on the first picture, and then there are other pictures are of an abnormal shaped uterus, where sometimes there may be only one fallopian tube attached to the uterus. Sometimes the uterus is divided completely into two different uterus, or sometimes there may be a big septum or a dividing wall inside the uterus. So again, which causes difficulty in conceiving. However, most of these women face problems like having recurrent pregnancy losses, that is recurrent abortions. But infertility also can be a problem. So in either case, if you have infertility or recurrent pregnancy loss because of these uterine anomalies, it is not a bad idea to go and visit a fertility specialist. Then women who have been diagnosed with known fertility problems, like you have gone for a gynecological checkup any time before, and or on your ultrasound, you have been diagnosed that your number of eggs in your ovaries are less. That is, you know that you have a low ovarian reserve, or you know that you have a low AMH, or then you have been diagnosed with any fallopian tube problems. For example, many times when you go to a gynecologist and they do the basic fertility evaluation, they check for your tubes, and in that tubal assessment, you have been diagnosed with tubal block, or you have been diagnosed with condition called hydrosalpinx. Or like the different problems in the uterus, which I mentioned earlier, you had fibroid, you know that you have adenomyosis, or you know that you have polyp, and also a male partner as well. Suppose you have got a semen analysis done before, and you know that there is some semen or sperm abnormalities. So these known fertility causing problems, if you have, you should go and visit a fertility specialist, because sometimes there may be problems in only one partner, but then there can be sometimes problems in both the partner. And managing these conditions is the first step in helping you to achieve your pregnancy. For example, if you have a low AMH, low ovarian reserve, what does this mean? It means that the number of eggs in your ovaries are less. So with each month, you keep losing eggs. So it is important that if you know that you have low ovarian reserve, you act fast, you go and visit your fertility specialist, and try to get pregnant a bit early. So we try to do a certain treatment, like we try to do ovulation induction, or sometimes we may even have to go for an IVF. Second is tubal blockage. For example, if you have done a simple test like HSG or saline sonogram and it has shown that there is a tubal block, if you go to a fertility specialist, they again reevaluate you. And if it is confirmed that yes, there seems likely that there is a tubal block, then we can go ahead with something called laparoscopy and try to know whether there is an actual tubal block or not. And if so, we can try to reverse the tubal block as well. And few cases of severe tubal block may sometimes require an IVF. Then third is hydrosalpinx. That means if your tubes are inflamed and they are swollen and large, they are edematous, and so such condition is called hydrosalpinx, which means there is water inside the fallopian tube. Again, it requires an assessment by a fertility specialist to know how badly the tubes are affected, and few cases require a surgical intervention. Now, if your male partner has been diagnosed with any known semen parameter abnormalities, that, for example, that means your semen has been analyzed, your concentration has been found to be low, or your motility has been found to be low, or the morphology of the sperm has been found to be low, or a semen analysis shows all of these together, then it is better to go yourself evaluated. A fertility specialist will do a physical examination of your husband or your male partner, would like to see your hormones, would like to recheck the semen once again, and based on the abnormality found, the degree of abnormality found, we would prefer to give either medical therapy or to improve the semen parameters. Then there can be certain men who have azoospermia. That means they have no sperms at all in the semen. Again, it is reconfirmed once again when you visit us. The embryologist centrifuges the semen sample and also checks once again if actually there are sperms there or not. We try to find out what is the cause of azoospermia. Sometimes it could be just a blockage in the path of sperm, or it could be the reason could be no sperm production at all. So these things are found out by physical examination, hormonal evaluation, and sometimes ultrasound examination of the male partner as well. And the right management plan is then discussed with you. Then those couples who have diagnosed medical problem. Now, this applies to both partner. For example, if you have been diagnosed with any thyroid issues like hypothyroidism, hyperthyroidism, in both females and males, thyroid issues can cause difficulty in conceiving because they affect the quality and quantity of sperms and eggs. Second, you may have been diagnosed with certain prolactin disorders, like it could be hyperprolactinemia. Again, this causes difficulty in conceiving. You may have been diagnosed with high blood sugar levels, that is, you may be diabetic. Nowadays, many young couples are coming to us with diagnosis of diabetes only during fertility evaluation. Now, diabetes causes a bad environment inside the body and causes a difficulty in conceiving, and also is an important reason for miscarriage. Also, in the male partner, diabetes can cause defect in the sperm quality. Then you may have been diagnosed with problems like anemia, for example, iron deficiency anemia. So, pre correcting anemia and correcting your body and correcting your hemoglobin before you are planning pregnancy will help you in achieving better pregnancy outcome. And also, if you have been diagnosed with issues like obesity and underweight, which is again a very important problem nowadays in the youth. So, correcting your BMI, achieving an optimal BMI somewhere between 18 to 24.5 will help us in helping you in achieving better pregnancy outcomes. Then those couples who have repeated miscarriages, those couples who have been facing recurrent pregnancy losses, or they have recurrent IVF failures, recurrent IUI failures, recurrent failures in ovulation induction, or those couples who have known genetic diseases in the family. For example, there is a child in the family who has Down syndrome, or there is thalassemia running in the family. So these couples require intensive evaluation by a fertility specialist. We do full genetic workup for both the male partner and the female partner. The full family history is discussed in detail, and plan is made out. Nowadays, because of the advances in the field of the fertility science, we have technology where we are able to know which embryo is genetically healthy. So this is with the help of technology called as pre-implantation genetic testing. The pre-implantation genetic testing is a test where the embryos which have been created using IVF are tested for any genetic abnormality, and those embryos which are genetically healthier are transferred into the woman's uterus. So by this, most of these known genetic conditions can be prevented, and also the risk of miscarriage and risk of pregnancy losses can be reduced to a large extent. Then those partners who have history of any surgery on the reproductive organ. For example, in a female, she had had any surgery in her childhood or in an adolescent or in the younger age on her ovaries or in a uterus or on her tubes. And similarly for the male, if he has had any surgery or any intervention on the testis, so it is better to go and yourself evaluated because there are chances of subfertility, and getting guidance and helping, and the fertility specialist can help you plan a pregnancy bit early. And secondly, also if those couples where either of the partner or both of them have had any form of previous cancer therapy, which could be in the form of surgery, it could have been in the form of any chemotherapy, radiotherapy, because these interventions for cancer has got a side effect in the form that the eggs and sperms go down, both in terms of quantity as well as in terms of quality. So, if you have been actually diagnosed with cancer, it is now a wise decision to go to a fertility specialist, get your eggs and sperms preserved for future use. So, in case you have been diagnosed with cancer, you should always think about fertility preservation. So you come to a fertility specialist, your eggs and sperms are preserved. You go back to your cancer specialist once your cancer treatment is over and you are now healthy. And now that you are planning a pregnancy, you can use these preserved sperms and eggs and plan a pregnancy. And also those couples who want to marry late, or those couple who are planning a pregnancy late. Again, for them, IVF technology is a boon in the form of that the social egg freezing and embryo freezing and also semen freezing. They can use these things and preserve their fertility, and they can plan a pregnancy at their own choice. So these are the various reasons why couple should come and meet a fertility specialist. And I'll just give you a brief about what happens when you are consulting first time with your fertility specialist. So we take your detailed history. We try to know what could be the reason for your not able to conceive. From a female side, we would like to know more about your menstrual history. We would like to know more about your obstetric history, which means that in case you have by chance got pregnant before, if there any history of miscarriage, and some details about your miscarriage or pregnancy losses if it is there. We would also like to know a little bit about your family history. After all this is done, we would like to do a physical examination for both the initially for the female. For a male, it's most commonly the first visit includes just a semen analysis, and if that's normal, they are usually done with that. Unless until that they have other problems like sexual problem or they have any varicocele, etc. And for a female, we also do a baseline ultrasound evaluation where we check through transvaginal ultrasound. We check for the uterus, we check for the ovaries, and though for those females where the fallopian tubes have not been tested, we advise them to go and get the tubal patency testing done, which can be in the form of hysterosalpingogram or a saline sonogram. A male partner evaluation, as I mentioned, most commonly it is a semen analysis, but however, where the semen parameters are not up to the mark, or if there is any sexual dysfunction, or if there is a decrease in the desire for sex, so such men require a physical evaluation and they also require a hormonal evaluation. So the first consult is generally to know more about you, to gather more information based on the ultrasound parameters, and also through certain blood tests. Through blood tests, you basically want to know what is your ovarian reserve, whether your thyroids are normal, whether your sugars are normal, whether your prolactins are normal. So once we have gathered all kind of information, it's only in the second or third visit that we sit with you with all the reports, and then we discuss with you regarding the various management options. As a fertility specialist, we always prefer to give you different options. We serve in front of you the various variety of options which are available with their plus and minus, that is with their advantages and disadvantages, and the success rate which is attached with each kind of management plan. It is you as a couple who decide which management plan suits you based on your finances, based on your time, or based on your choice. So this is so. I hope I have been able to tell you in brief regarding the most important question, which is always there in the couple's mind, that when to meet. So I hope this information was useful for you all. And now I would be happy to answer if there are any questions in this segment. Yes, please can you display any questions if there are there by the audience? So the first question is, if I am diabetic, should I consult a fertility specialist? Yes, it is very important to consult a fertility specialist, because if you are diabetic, we need to know what are your present sugar levels, what is your current HbA1c level. Few times, if the HbA1c levels are very high or if your sugar levels are not under control, we even ask you to prevent pregnancy for till the time your sugar levels are under control. If your sugar levels are very high and you get pregnant, there are high chances of having miscarriage. There are chances of having any malformations within the baby, which we do not want. So till your sugars are optimized, we need to prevent pregnancy. And even once the sugars have been optimized, then we can plan your pregnancy, keep you on antioxidants. We need to give you folic acid. So it is important to meet a fertility specialist. So till what age is best to go for egg freezing? Yes, so egg freezing has become very common now because women are more career oriented and they are also planning pregnancy late. They are also searching for a partner late. So the earlier the better is the answer, because the younger you are, you have more good quality eggs and more number of eggs. And so if you delay every actually every year, your AMH decreases, you are losing your egg reserve. So ideally, it is better to freeze egg at least around the age of 30 years, and at least before the age of 35 years. Is IVF the only solution for tubal blockage? So no, IVF is not the solution for tubal blockage. If the tubal blockage has been confirmed on a basic test like HSG or saline sonogram, it is important that we first we confirm that there is an actual tubal blockage by doing a laparoscopy. Most of the times in laparoscopy, there may not be any tubal blockage at all. In case it is there, we can even try to open it during a laparoscopic surgery by procedures like tubal recanalization. And if we are successful with tubal recanalization, the couple can try naturally for a few months, and or even try with a few basic procedures like IUI. Only in laparoscopy, laparoscopy, if we see that the tubes have been very badly damaged or the tubal blockage is very bad and it's not reversible, only those are the couples who require an eventual IVF. So is it not necessary to use sugar tablets for PCOD patients while trying for pregnancy? Yes, it is required. It also depends on how severe is your PCOS. Most gynecologists and fertility specialists, they prefer giving sugar medications for PCOS. It is why? Because PCOS females, they generally have very deranged sugar levels. The insulin levels keep on fluctuating, the sugar levels keep on fluctuating, which is also a reason for increasing the PCOS. So we give sugar tablets so that your insulin levels are under check and so that your PCOS is under check and you ovulate normally. So it is a good practice to keep you on sugar tablets, and there is nothing absolutely to worry about. So I think these were the few questions which have been asked by our viewers. And if there is any further question, you can please ask in the comment section. And also our helpline number has been displayed. So thank you all, one and all, who have joined us here.